Hello, my name is Dr. Tiffany Tyler-Garner, and I have the privilege of serving as Executive Director of the Children's Advocacy Alliance, where we're dedicating our time, talent, and resources to improving conditions for children in the areas of education, economic well-being, safety, and health. Welcome to our podcast on early investments, where we'll be joined by Annette Dawson Owens, Jamelle, Nance, and Chelsea Bishop.
Thank you, Dr. Tiffany Tyler-Garner. We at the Advocacy Alliance value parents and parent voice and know what a difference their stories can make. And so we would like to introduce Chelsea Bishop here today.
Thank you for having me today.
Thank you, Chelsea. Will you just share with us a little bit about your story, about your family, and some of the things that you've been through?
Yes, certainly. So I'm born and raised here in Henderson, Nevada, and left for college, and then we moved back here with our kids. And so I'm a pediatric registered nurse, and I've got 2 biological children, and then we've got a 1-year-old in our family right now that we're foster parents to. And we have had quite a medical journey with our kids, and my husband's also in the medical field. He's a physical therapist. But my oldest was diagnosed with stage 4 high-risk neuroblastoma when she was 2.5, and she was on a 6.5-year journey of treatment, and it was a wild time through those years because it was just a lot, and she went through all sorts of different types of treatment, and we pretty much hit every kind, and she unfortunately passed away last August, and that took us quite, it was a really deep experience for our family, and a lot of things went down with that. We have a 7-year-old who is just a joy, and she herself was born really tiny. She was born IUGR, and then at age 2 we found out she had cerebral palsy, and she had a lot of growth conditions that we were worried about, and movement, and so she's been through a lot, and she's really thriving right now. She's in 1st grade. She loves life, and she's loving on this little baby that we have. We have this little baby for the last, about 6 months or so, and she's just a joy, and she was premature herself, and so we've got some medical things have been going on with her too, but we really love the community here, and we love raising our family here, and so we've felt like throughout these years we've really been able to get to know the community more, and especially now that we're in schools and everything, we've got a wide range of experience just interacting with others, and we really love it here.
Thank you, Chelsea, for sharing that. You've been through a lot, your family has, and I know the community loves your girls and all that you're doing. And we're grateful for you being here to share your story. It's a compassionate community, and I know you've experienced a lot of that. And thank you for sharing the journey, which may be a little difficult at times.
Thanks.
Can you tell us what has helped your children thrive that you've seen here in Nevada? You talked about some of the access to things or lack of. What has really helped your children thrive here in Nevada, and what might be lacking?
Oh yeah, okay. So if we go with the thrive aspect, something that we were involved with, and now it's been every single girl that we have, is early intervention services. And for my oldest, Navy, hers actually didn't have to do with the cancer part of things. Her speech was delayed, and so we had early intervention come probably from about age 18 months to about 2.5. And then Riley was really involved with early intervention. We had a lot of delays that we were working through, and they really helped us learn about services here in the Valley that I wasn't getting from the doctor's offices. They were the ones that were really connected and would come up with different ideas like, oh, have you thought about this therapy? Have you thought about genetic testing? And so they really helped me get kind of the broader picture of what could be going on with her when we were still figuring out diagnoses and such. And then the little baby we're taking care of right now, and we're using the services for her too. And anyway, that's been a really good part of their medical journey that we're really appreciative that we have these services here. And then the other one is just the high quality preschool. That's something we used for my 7-year-olds. She was in the preschool at the public preschool that had the extra resources, and that was an amazing experience. The teacher there just had so much experience working with children of all different abilities, and had a lot of experience with her specific disability. And so she really helped her thrive. I think having that experience with the other children too was just like a jump start. It really helped her mind develop, her social skills develop, and all of those things.
That's wonderful, good. Chelsea.
Yeah.
How does a parent know? I mean, both you and your husband are involved in the medical profession.
Yeah.
You are able to have access to different service and things, but how does a parent who may not know or may not have resources, how do they find those for their children that they need, or may not even know that they need?
That is a really good question. And that's part of, I think, the lacking part is that we felt like there were challenges along the way to get certain services and even just diagnoses. And I felt like, okay, we've got education under our belt. We have like family support here. We have like a community already here. And why are we not like able to figure out what's going on? Like Riley had a lot of feeding difficulties. And since she was born really small, feeding and movement. And all of up until age 2, everybody was passing that off as, oh, that's because she was born small. That's because she was born small. Wait till she's older and she'll grow out of it. And she wasn't growing out of it. And that's when we really had to seek out more resources. And like you said, like I'm grateful that we were able to seek out those resources. We had help from family. We were able to travel to Chicago to go to a growth conference because that's all we were focused on at that time. And that at that growth conference, the doctor there said, no, you need to be worried about her neurological condition. And I was like, oh my gosh, I am a nurse and my husband's a physical therapist. How are we not like figuring this out ourselves? And why haven't we been able to figure this out with our pediatrician? And so I have a lot of compassion, and I think that fuels a lot of my drive to voice our story, just because I know we can do better there. I think as far as families go, what they can do themselves is advocate, speak up. I'm a big fan of writing down things. So I would just get my girls' medical things confused a little bit. So I had a Google document, and I would just write a timeline of like what we had done for them, therapy or treatment, and then if at the next appointment I could bring that and be like, okay, this is what we've been up to lately. These are the people we've seen. And that really helped me, but I found like, okay, why am I having to do all the advocating just myself? Whereas people maybe without that education or without the family support, all those type of things, how are they supposed to be able to do these things for themselves? So that does fuel a lot of my what I want to see done better here.
And I love that fuels your desire, because even though you've navigated this and you've found some solutions, you're advocating because of your compassion, it seems to me, and wanting to share with others so they don't have to go through some of the things that you've been through.
Yeah.
I know you shared a story with me, and you talk about having to go outside of Nevada, and you also talked, I think, about the radiology read. And do you want to share anything about that?
Yeah, we found at the beginning of my oldest daughter's neuroblastoma treatment, we were getting a diagnosis, and we were in a hospital here. Great hospital is the hospital I worked at, so I really liked it, and I loved the people that I worked with. But we found that the scans for her first tumor that we found were read by an adult radiologist, where maybe in a lot of circumstances that's okay and great, and you can get, and I know that they're bright people reading these scans, I can't do that. And so we have to trust them, but when the adult radiologist read it, he had 4 different cancers he thought that it might be. Where we had a friend who knew a pediatric radiologist, we sent the scans over to them, And he read it, and he knew exactly what type of cancer it was, just based on right where it was. And so I just thought, gosh, like, what if we could have all children's scans read by a pediatric radiologist? This can make a huge difference. And it could have. We ended up doing a surgery to biopsy it, where we might have been able to bypass that surgery. And when I think more about those things, then you think, like, what about saving money even for these, like, you know, insurance companies and hospitals? Like, that could have saved money of a surgery. So, like I said, like, we have been surrounded, and I like that you brought up compassion, because we have been absolutely surrounded. I'll get a little emotional on this, but absolutely surrounded by people who care. And whether that's in the hospitals, whether that's the doctor's offices, the incredible school community, church community, like, people really care, and they want to do what's right, and they want to help. And we've been surrounded by that.
Thank you for sharing your compassion. I'll never forget the compassion I saw in the community as they came out for Navy's Make-A-Wish. It was a beautiful thing. And I love that you're dedicated to improving outcomes for other families so they don't have to go through some of the things that you've been through. And you are a great resource for us to help us understand what Nevada could do better to change outcomes for other children experiencing these things.
Thank you. It's really, like, really, you brought up the Make-A-Wish. I could list off just so many different things that the community's done for our family, and how that's, like, lifted us and carried us through that time of treatment, and then even after she passed. It was really remarkable to see. And I think of the nurses that were there, like, the day she passed, and just the compassion they showed our family and trying to help us, and child life specialists. And, you know, it's just amazing the people you come across when you go through something like that. It's like you're cradled in this, like, with nice people around you, you know? So I think of that, and then I think of, gosh, like, what system are they working in right now? It's fragmented, and it's not comprehensive. It's not cohesive. We've got all these, like, independent doctor's offices. I even made a map of, like, all the different doctor's offices that we had been to. And I made a map of all the different doctor's offices that we'd been to, and all the different specialists that we've been to, and the therapy offices. And I was just dotting all over the valley, you know. Right. And that makes sense for, like, a small town, right? You're going to be, but we're not in a small town anymore. And then we went to our children's hospital. We went to a few different children's hospitals during treatment, and I see a whole list of every single specialty all in the one elevator that you could just pick which floor you're going to, you know. And that just really was like, whoa, this is so different. And so I think of all these compassionate people. If they had a framework that they were working in that could be cohesive, that can have great communication between the offices, that the hospital can have all the specialists that actually work there. Right now, you're going to different hospitals with different specialists. And we've got the heart here. We've got people who are really bright, and people who are really smart, and they want to help children. And I just hope for a future that we can have this really cohesive and comprehensive space that are helping the children. So
thank you, Chelsea. I would imagine that would have helped on your documentation process.
My documentation
process. Saves you some time and energy devoting to other things that you wanted to. So
true.
Thank you for sharing and being a resource for us to learn from and to advocate for going forward. I know you mentioned that you foster a child now. Can you tell us about what motivated that or how that came about?
Oh yeah, well, I'll speak a little bit on both my husband and I. My husband, he grew up with his grandma actually fostering, and she took under quite a few children in her home. And so he grew up hearing those stories. Of course, he was younger, but and then interacting with these, you know, adopted aunts and uncles. And he just really cherished that experience for him. And then on my side of things, when I was working as a pediatric nurse, there you'd get assignments that were just solely medical. You know, you're doing all the med-surg type nursing care. And then you'd get assignments that were children who were just born, and they're waiting for a foster or adoptive family to come. And and it could be days. And so I would get these assignments, and you're the only, it's just the healthcare team is the one that's taking care of this child. And gosh, that broke my heart. It just was like, you just wanted to sit and hold that baby. We know how important the first days, months, years of a child's life are. And so we would hold that baby as much as we could, during that shift, and just love on all those little babies, because eventually they got a safe home to go to, but until then, that really just opened my eyes, and I thought, gosh, I'd love to do that someday. And so a couple years back, we got licensed to be foster parents, and it was a great experience. We learned a lot, and we were able to take one short placement, and then Navy's treatment got sped up again, and it got pretty intense, and so we took a break. And then a little bit after that, after Navy passed, we had a family member who was fostering, and she wasn't able to take care of the foster baby anymore. Her health was declining, and it kind of fell into our laps, and we were able to take this sweet baby into our home, and it's been a great experience. We've had a really wonderful time interacting with all the team members there and the biological family. It's been really rewarding, and we want to help in what ways we can for that. So.
Thank you, Chelsea. Thank you for sharing that and for being an inspiration to us to take that call to action. We know that our governor recently came out and talked about the increasing need that he's been seeing and our community has seen with infants and toddlers needing someone to foster care, and actually did a call out for foster parents, especially for those ages. So that's concerning and so important. We know what the difference, as you said, these early investments make in children's lives, and are so grateful for you being here as a guest with us today and sharing your wealth of knowledge and your compassion, and really showing us what can be and what we might envision for our future here in the care for children. So thank you.
Thank you. Thanks for having me. It's been great to talk to you.
Thank you, Chelsea, for sharing your inspirational story today. We'll now continue our podcast with Jamelle Nance, who serves as our Prenatal to 3 Initiatives Director. Thank you for being here and for all the work you're doing at CAA. We know that what an asset you are to our team. If you will go ahead and tell us a little bit about yourself and how you got into the work and your why.
Absolutely. So excited to be here today just to share with you a little bit about what I do. As Annette said, I'm the Director of Prenatal to 3 Initiatives, and so it gives me the opportunity to really advocate for our children and families here in Nevada. So I'm really excited about just being able to hone in on the critical time of the first 3 years of life and really making sure that we have policies and priorities that support our young children.
Thank you, Jamelle. And why are those early investments so important? What have you seen in your work which is abundant that speaks to you about those investments?
So early learning investments are so important because the first 3 years of life, there's so much development taking place in the child's brain and body. And so it's critical for us to make sure that children have the best opportunities to shape their development, whether it be for childcare or their relationship with their parents. We want to just make sure that children have every opportunity to quality early experiences.
Thank you, Jamelle. And what is CAA doing lately? What is the Children's Advocacy Alliance working on that you want to share with us?
Well, I'm glad you asked that question because we have the Strong Start Collaborative that is comprised of directors and legislators that come together as one to fight for this one mission to ensure that our children prenatal to age 3 have the best opportunities possible. So we come together and we strategize on policies and priorities that really will have the best outcomes for our children. So that consists of meeting together. We have 3 separate work groups that we're working towards, which is maternal and child health, early learning and child care, as well as community health workers and home visiting.
Jamelle, can you expand on what a work group is?
Definitely. So a work group is a more intense, individualized segment of the Strong Start Initiative. So we break down those work groups into those 3 specific initiatives so that we can really hone in on those policy areas that impact children and have the best outcomes.
Thank you. And what barriers are you seeing in our community now with access to those early investments?
So we have such a great relationship with our partners and our community-based organizations that really make sure that they share what the barriers are on the ground level. So one of the biggest things that we're hearing is access to quality childcare as well as the workforce as it relates to childcare, making sure that there are sustainable wages to support childcare providers.
Understand. So Jamelle, what would be a call to action for the community who might need some of those child care opportunities, those high quality investments that you're talking about? What could the community do as a call to action to help further the work along?
Absolutely. So one of the major things is to get involved, to get out there and get connected to your community-based organizations or your faith-based organizations so that your voice can be heard. Aside from that, we also have the Parent Ambassador Program where we're working specifically with parents to engage them to speak out to their legislators about the problems that they're seeing. So definitely you can also visit our website to share your story, to share why these investments are so important. And so we want to offer multiple venues in which a parent or a provider could share their story.
Okay. So Jamelle, what would you say to a legislator or a community leader who maybe didn't feel that there were funds available for these early investments? What would you say to them?
I would say that now is the time to invest. We have to invest now so that we can have children that have a strong start to their bright future. The first 3 years of life is just a short opportunity to ensure that our children have the best. And so if we invest now, then we won't have to put the funds in later for social support services. If we put the funds in on the front end, then we will have that return on investment that we so need for our children.
Thank you, Jamelle. And I agree. I've seen those investments in children in the early years, and we know that the data shows that the best predictor of a child's future success is whether they are ready for kindergarten, that kindergarten readiness. So high quality child care is so important.
Absolutely.
Can you share a little bit about your why? What drew you to this work?
Sure. I'm a parent, so I know how difficult that it can be to be able to afford childcare. I know how important it is and how children really thrive when they have that structure, environment, and those experiences early in life. And so I have such a passion to want to just give back and make sure that those who need it most have those opportunities to give to their children so that they can have the future they deserve.
Jamelle, do you think that in Nevada we have equal access for all children to the high quality early learning experiences that they need? What are you seeing as you come here from another state and are committed to the work here in Nevada?
I think that there have been some great strides towards it. I think that we still have a ways to go. There are still areas, particularly in our tribal populations, that we cannot forget. So we definitely have made some great strides here in Nevada, but we still have a ways to go.
Jamelle, what are you seeing in Nevada regarding equal access to high quality care in all of our communities?
Well, one of the things that we have noticed is the lack of integrated data systems. The lack of opportunity to have that real-time data really puts us in a position to not be able to make decisions that are pertinent to what's happening in the moment. So therefore we won't know where child care providers are most needed. So that's one of the things that I know several organizations are really working diligently on, but it's something that is critical to ensuring that every child has access to quality care.
Wonderful, and that would help us understand some of our weak spots. Have you seen any other weak spots or certain populations that aren't as well served as others?
Absolutely. We are continuously working to engage our tribal populations. We know that there are some definite needs and concerns in that area, and wanting to make sure that we have equal representation across the board, that all children, and when we say all, we definitely mean all children, have access to quality care.
Thank you. Can you tell me, you mentioned your Parent Ambassador program. Can you tell me what a Parent Ambassador really does?
Absolutely. So our parent ambassadors are a phenomenal group of parents that come together to really advocate for children. They have a hunger just to be able to have their voices heard, to share their experiences, and to advocate for policies that impact not just their families, but families across Nevada.
Thank you. And I know that you've been working hard to incorporate those parent ambassadors into committees, and not just the training, but to make sure that they are at the table and solution oriented, and I think that's beautiful work that you're doing, as we saw today with Chelsea.
Absolutely, and so we're excited to have Chelsea on today and to share a little bit about her story.
Jamelle, can you tell me what you would say to a legislator or a community leader who felt like it wasn't worth investing in these early learning child care centers or the early learning investments that we know are so critical for our children?
Absolutely. I definitely believe that the return on investment is critical, that if we invest the funds now for quality care, that we will see the return on healthy, strong children in Nevada that grow up to be healthy and strong adults.
Agree. And then less likely to be involved in the justice system, the juvenile justice system later on. And I believe the return investment can be as high as 13%.
Yes.
And so if you're Vegas and you're betting on something, that sounds like a really great bet to me.
Absolutely.
Thank you so much, Jamelle, for joining us today and for sharing the work that the Children's Advocacy Alliance does. We know it's so important. We're grateful you're here and part of the team. As we close out, can you share with us a call to action that we should do in our community to help advocate for these early investments?
Absolutely. So we definitely want you to be involved in your community, to find those community-based, faith-based organizations, whatever appeals to you, to get involved in your community. Also, you can visit our website to share your story. If you have a personal story that you want our legislators to know about access to child care or health care, please share your story. Your story is invaluable to the movement of policies and priorities here in Nevada.
Thank you, Jamelle. And we've seen that today with Chelsea sharing her story and the power of a story. So would you like to share how they can reach out to CAA?
Absolutely. Please visit our website at caanv.org.
Thank you for joining our podcast. Please be sure to tune in to our next podcast where we'll explore foster care with Deshaun Jackson and Vicki Wilson.